Hello and welcome everyone to our webinar this afternoon, Strengths and Opportunities, Where Next for Social Care Analytics. This event is run by the Community of Practice for Social Care Analytics, which is supported by the Health Foundation, and is run by us at Future Care Capital. I am Josephine Magnusson. I am the Senior Research Officer at Future Care Capital and also lead on the development of this Community of Practice. Future Care Capital is a 70-year-old charity. We have Her Majesty the Queen as our royal patron, and our vision is to see everyone in receipt of care benefit from a fit-for-purpose health and care system. We do this by activities in three key ways. So we work with policymakers to influence and support. We work with and support healthcare practitioners through our research and project work. And we also put our money where our mouth is by investing and partnering for social impact. So our program today is going to look like this. I am going to shortly move on to introduce our panelists. And after that, I'm going to go through the research we did earlier in the year on a SWOT analysis of good social care analytics. After that, we're going to hear from Victoria Scott from Greater Manchester Health and Social Care Partnership, talk about the work that they're doing that. And after that, I'm going to be talking to Laura Ladd from Autonomy about the work that they are doing in order to support vulnerable people live independently. After that, we move on to a panel discussion and finally to audience questions. And I would encourage everyone to put your questions into the Q&A box throughout the event. If you have questions for particular speakers or panelists, then please put their name in together with your questions so that we know where to address them to. So these are our speakers today. And I am going to give you an introduction to everyone who is here. So first of all, we have Ellen Coughlin, who is from the Health Foundation and who manages a program of work at the Health Foundation seeking to advance the use of data analytics in health and care. This portfolio has awarded over £4 million to more than 50 teams across the UK, seeking to apply innovative analysis to improve care planning and delivery and healthcare, solve challenges facing social care analytics in the wake of the pandemic, and to build a community of practice around health and care analytics. Ellen's background is in primary care analytics. We also have Arnie King, who is a social researcher who has spent the last few years carrying out a range of diverse projects to improve the care sector and connect stakeholders through a new non-profit network, Co-Produce Care CIC, which is based out of the small SME provider in Bristol Manor Community. Project topics include tech and data in care, democratic platforms for the workforce, and inclusive learning. Then we have Victoria Scott, who has 15 years experiences in analysing public sector dataset, focusing on adult social care in the past 4 years, and currently working for Greater Manchester Health and Social Care Partnership as a senior analyst in adult social care. While working at Greater Manchester, Victoria has designed and developed many of the adult social care Tableau dashboards that are shared across social care and NHS organisations in Greater Manchester using the Tableau Server. Victoria has managed a project to develop the first ever client-level data collection, working in collaboration with Greater Manchester adult social care analysts on design and development of the Tableau reports during Agile sprints. And Victoria will talk more about this work later on. Then we have Laura. Laura is the Business Development Director at Autonomy, and she has over 15 years experience developing, delivering, and managing innovative programs and services for vulnerable people. Laura has been instrumental in the development of Autonomy services, specifically in using data and feedback to better support people's learning. Prior to joining Autonomy, Laura worked for the Princess Trust, developing public and private sector partnerships designed to support disengaged young people, primarily in the employment outcomes, and United Response, developing supportive services for adults with learning disabilities to live more independently. And like I said, we will hear from both Victoria and Laura a bit more in a little while, but I am going to first of all take you through the SWOT analysis that we did via the community of practice earlier this summer. So this exercise came about through a variety of conversations that were being had and talks about social care analytics, and focusing really on both what the opportunities and the challenges in social care analytics really are. And we wanted to undertake this analysis to get a better understanding of what the priorities are for people who are working in adult social care analytics. And so we developed this analysis as an exercise and consultancy through the community of practice. And first of all, we developed a number of items for each of the sections, so strengths, weaknesses, opportunities, and threats. And those were really based on conversations that were had within the community of practice forum, through events that we had been attending and running, and through various reports, whether that was policy papers, research papers, or other reports coming out of organizations, using that as a basis for our first draft. We then took that to a small group of stakeholders that we'd work closely with as community leaders for the community of practice, for them to give their feedback on, to reflect on the items that we had already collected, whether they thought there were things that needed adding to what we had already produced, and whether there were things that needed changing. And after this revision, we put the consultation out to the community more widely and beyond the community as well, in fact, and open it up for comments. And the feedback that we received, we asked people to comment on the items that were already available, so that they could put their opinions across, whether the things we had identified were reflective of their experiences, whether there were things they felt needed adding or changing around or rephrasing. And we also asked them to rank the items within each of the squares of strengths, weaknesses, opportunities, and threats, to see which ones were most important to them, so that we could get an idea of what the priorities were in each area. And this is the outcome of the research that we were doing. So in terms of, I should say first of all that we found it much easier, both from our perspective but also from the people we were talking to identify weaknesses and threats than we did strengths and opportunities. But we do have a good number of positive options to start building on. And first, when we're looking at strengths, so in each of these boxes, the first 3 bullet points within each section are the 3 highest ranked priorities for that particular section. So in terms of strengths, what the people that we consulted felt were the most important strengths were, first of all, the increasing acknowledgement of importance and inevitability, really, of data use in social care. So this was seen through policy developments such as the white paper earlier in the spring, and then the national data strategy later this summer, and other documents. The second most highly ranked strength was connections across systems that were already taking place of parties engaged and interested in this work. So a growing recognition of the growing collaboration that is happening in this space, and the growing interest in this space. And thirdly, that plenty of data is already being collected. So it has often been said that social care is falling behind health in terms of the data that is collected. But if you're looking at the sheer number of data, it is often there. It just might be difficult to access or to get it in the right format. So moving on from the strength onto the opportunities, starting off with the positives here. Again, the focus in policy and in other documents, such as the white paper and the national data strategy, was seen as the greatest opportunities for social care analytics going forward. The fact that this is being recognized in this space, and that the emphasis is put on this in these areas, was seen as a great opportunity. But also the new ways of collecting data and collecting and analyzing data, such as machine learning and AI, and the developments in these areas were seen as great opportunities as well. When it came to weaknesses, the most highly ranked item difficulty in this area was that data is patchy and inconsistent. And there was also concern about digital immaturity in organizations that are tasked with collecting the data. And finally, another weakness is a mix of provision across the sector. So, for example, the fact that you have social care provision coming from local government, from private, from not-for-profit sector, which means that there's little streamlining across the sector. And finally, with regards to threats, the overwhelmingly most highly ranked threat was the issue of who benefits from the data. So does data empower people in receipt of care or the system that provides it? And I would say this is the greatest concern of the people that we were talking to, but also a concern about the people who are providing the data in the first place. What are they getting back from it? The professionals who are working on the front line, will they see the benefit coming back to them directly, or at least to the organization that they're working from, when data is mandated from up above? Linked to this, other threats we've seen the burden of data collection and sharing on the workforce, and also bias in information. So, for example, we have areas we have less information on, like, for example, people who are cared for in their home by maybe friends and family. The absence of data in that space could be a potential threat as well. So what does this all mean? I think if we're looking back and looking at where we were a year ago, we can say that social care data certainly has a very different status now than what it did just there, which is seen in these documents that we have seen going forward, and that does provide a great opportunity for taking social care forward. I think there's still some concern of whether social care and social care data is seen as important in its own right, or if it is seen as an add-on to health. And I think that view depends on the organization or the sector that you're coming from. And there are also issues about whether systems are set up to take account of the diversity of social care, so the differences in from different types of providers. We want to look at the opportunities and the positives here, though. So we're looking at how you can turn weaknesses and threats into opportunities and strengths instead. So, for example, digital readiness was something that was seen as a clear weakness of the sector. However, we know from a great report published by Digital Social Care and Skills for Care earlier in the summer that digital readiness is improving across providers, partly due to the COVID pandemic, which has forced providers to digitize in a different way. But that means that the opportunities going forward in that way will probably just improve and improve. But we mustn't forget about those who are still struggling with digital accessibility and find ways to help them to get up to the level of the rest of the sector. The mix of provision that we have with regards to social care is probably not going to change in the near future. So a better way of looking at that might be looking at opportunities for what we can learn from, what different sectors can learn from each other in the way that they collect and use data, and whether there are opportunities there that can make the provision across the data more streamlined. But in order to do that, we need to ensure that collaboration is happening and that it's being taken care of. So in order to look at this better, we have started looking for exemplars of good and innovative views of social care data. And in a little while, we're going to hear a couple of presentations that are examples of this, and the idea is to share these more widely and start sharing these exemplars across different types of organizations so that we can learn from each other and learn from best practice and provide those necessary connections. I'm going to, before I move on to our next presentation, I just wanted to put a couple of questions out there with regards to the analysis that I just presented. So I just wanted to ask Ellen from the Health Foundation, when we're looking at the opportunities identified in this analysis, what the people that we consulted rated as most important were the recognition of social care data in policy. These developments are important and they're welcome, but they're really just a starting point for making better use of social care data and analytics. So I'm wondering, as the program manager for the social care analytics program at the Health Foundation, how do you see these developments influencing your work going forward?
Yeah, that's a really good question. And you know, as a foundation and as a data analytics directorate, we really welcomed the National Data Strategy's focus on the specific challenges facing the social care system. You know, and we published a policy analysis in May that, you know, highlighted how difficult it was really to truly understand the impact of the pandemic, because, as you said, the lack of information around particularly care provided beyond care homes, which, given the increased mortality in those amongst those receiving domiciliary care, was you know, gravely concerning. So the data strategy in that sense really hit the right notes. So our work is going to continue to, you know, examine the health of the social care system and contribute to the national conversation about what's really needed now to implement that strategy. So there's, you know, we'll be waiting to hear more about the mandatory data collections, and we'll be highlighting, you know, how important it is that those data that are collected really reflect the lived experience of people receiving social care, and how the insight that's going to be generated from that data will be kind of fed back, as you said, so that there is a reciprocal benefit for the providers. And I think as well, you know, much of the vision really relies on, you know, digital transformation and uptake of new tech and you know, appropriate and safe data collection and sharing. And so I really think the whole adult social care system, and this is not just the workforce, but those receiving care and those, you know, providing informal care as well, need to be equipped with the right skills and right tools within kind of a culture of trust to do that well. So you know, to be able to secure that sort of sustainable legacy for adult social care, we'll be looking forward to making sure that the lessons that we can learn from the program that we have developed and the evaluation that we'll run, we'll make sure that those are all fed as much as we can into that conversation about that implementation of the vision.
Great, thank you. I think the work that you are doing and the fact that you're focusing on this program is also another good opportunity for this space. On the whole, we have the other projects that have been funded through the program as well. So all of this is contributing, obviously, to the benefit of social care analytics. I think I'm going to save further questions to the panel discussion and instead introduce Victoria, who is going to talk about the work that they have been doing in Greater Manchester. There you go, Victoria.
Thanks, Josephine. Hi there, everyone. I'm Victoria Scott. I work at Greater Manchester Health and Social Care Partnership. I'm going to talk about adult social care analytics and how we've managed this across Greater Manchester as a partnership. Next slide, please. So I'm going to cover just a little bit of background to provide some context, the need that we had, and the methods that we used to address the need we had in Greater Manchester. Next slide, please. So you've heard enough about who I am. Greater Manchester Health and Social Care Partnership is a bit of a unique organisation that was formed about 5 years ago, and it spans a very large population and a very large number of organisations, both NHS and local authorities and trusts. And we manage our own health and social care budget, basically, as part of devolution. This is, I feel, quite relevant at the moment because I think the rest of the country, as well as ourselves, are in the process of becoming integrated care systems in different regions across the country. So the partnership will be changing to be Greater Manchester Integrated Care System soon. but we have been working this way for a while now, so we've got a bit of experience that could possibly be drawn upon. Next slide, please. The need that we had when I started working in this role was basically we didn't have any data, well, very limited infrequent data available, and this was from national data collections mainly that were sort of annual. Sometimes you couldn't filter down to the level that you wanted to get to as well. We wanted data to be easily shared across all of the organisations in GM, and we wanted to make sure it was visual and interesting and interactive. I put that business intelligence pyramid on the right just to show basically we were really starting from the very foundation of that pyramid at the bottom, where we were starting from having no data really at all. So there wasn't any, it was going to be difficult to get to the information and knowledge sort of sections without it. Really, local authorities had their own data and would use that, but that's sort of different to the partnership way of working across all of those organisations. Next slide, please. So the ways that we addressed the need that we had in GM were 4 different ones. MinAsk, which is a data collection. Tableau Desktop, which is analytical software. Agile sprints are the method we use to work collaboratively across GM. And lastly, Tableau Server, which is where we were able to share dashboards across GM with different organisations and people. Next slide, please. So firstly, MinAsk, I believe it was the first ever service user level adult social care data collection. It will now be a national one called Ask CLD, which people may have heard of, but this started about 3 years ago, I think. Within that, we collected very detailed data on things like assessments, reviews, services, contacts. We split it by all sorts of demographic data. The design of it was designed by adult social care analysts themselves across GM in the local authorities. So they knew more than me, really, about how to define the different data items to be collected and what was possible as well. So we produced that tech spec. There's a small screenshot there, and people submitted. We had to develop a portal for submission and validation of the data as well on Tableau. Next slide, please. We also purchased Tableau Desktop for myself and all the analysts in adult social care in local authorities across GM. We had some funding for this, and we also had a person in a post to facilitate learning how to use that software. For those of you who don't know, it is basically visualization software. So you can use all sorts of different charts, anything from tables to box plots, scatter plots, tree maps, everything really. And they can look really smart, be fairly easy to create as well. It also is very fast to view, which is one of the advantages. It's got a special hyperfile format for the data extracts, which is really useful. Next slide, please. For the dashboard designs, it was really important that we got utilised the knowledge of the analysts across GM, because they know the data better than anyone, and they know the needs of senior managers as well with regards to data. So we used Agile sprints. So there's a photo there where we're working together, and you literally draw out how you want the dashboard to look. and design it. And then we developed it together as well in the room, come up with much better end product that way than if it was just me working by myself. It's a really great way of harnessing people's knowledge in the area and experience. Next slide, please. Lastly, we use Tableau Server, which is basically where the dashboards get published to, and it sort of acts as a portal for the dashboards for users to interact with them. They can filter the data, extract summary data as well, and download it. It's been quite successful. There's nearly 5,000 users, I think, now on our GM Tableau server across the NHS and adult social care. And it's been used even more during the pandemic to get the latest data as well. Next slide, please. And thank you very much.
Thank you. Thank you, Victoria. I have some questions, and just to remind the audience as well, if you do have questions for our panelists, then please put them in the Q&A, and we'll get to them eventually in our panel discussion. Before Victoria, I'm just wondering, first of all, could you tell me something about the challenges that you've encountered while developing this and implementation, how you overcome those?
Yeah, so I think one of the major ones was information governance. Just to collect the data in the first place was really, really difficult. It took time, and we did have to get agreement from a vast array of different people across GM to do that, because it's the first time that this sort of service user level data had been released from local authorities. And I think perhaps some NHS organisations are used to doing this and releasing it out into the wide world kind of thing for analysis, further analysis. But it was a bit of a culture sort of shift as well. But we got there eventually. There's some lack of resources in really with sort of analyst time. There's not many of them in local authorities, and there's not many of me. They're just me. And equipment for the sprints, even just that were held. Some people found it very difficult to even get a hold of a laptop in local authorities. There's just really basic things that were difficult, or they weren't set up to work in that collaborative environment. They were set up to have their laptop in their local organisation, for example. So that kind of working was challenging, but yeah, again, there was the analysts were motivated to do it, so we did get there. And a sort of a cultural change as well in how you view reports. I think a lot of senior managers were used to seeing static, non-interactive reports, saying a PDF document or PowerPoint, whereas we're asking them to log into Tableau Server, which is a portal. They have to go there, interact with it, delve into the data sometimes themselves. You can extract it, but the idea is that it's a little bit more self-serve and interactive in that way. So that was a challenge. You can encourage people to log in by kind of subscribing them to reports, and it gets emailed to them and things like that. It's got that functionality on Tableau Server. So that was one method we used. And I can't think of any. There's probably many other challenges, but I can't think of them right now.
Yeah, sure. I also wondered, when we talked before, sort of earlier in the summer, we talked about how this kind of work is often occurs in silos. So you're doing really great work in Greater Manchester, but you wouldn't necessarily know what is going on in other areas, even those sort of bordering your own. So I guess that means that there could be unnecessary replication of effort and missed opportunity for learning from experience. So within the community, we are, like I said, trying to bring forward these exemplars of good practice so that other people know what is going on out there. But I'm just wondering, what more do you think can be done to bridge this gap? What kind of communications are necessary?
It's a difficult one because we all get so used to keeping our heads down, and my focus is Greater Manchester, and that's kind of it. But that's why things like this are important, where you can reach a larger audience, and there probably is things going on elsewhere in other regions that I don't know about, I could learn from. But if we can try and keep in touch best we can. I'm not sure I have the answer exactly.
No, that's fine. It's just because we were talking about it before, I think it's interesting.
Yeah.
I have some more questions relating to this, but I think we'll take that during the general discussion a bit later. So I'm going to move on to Laura now, who has provided another exemplar for the community of practice of rather innovative use of data to benefit people in receipt of social care, and particularly those who might be considered vulnerable. So as already mentioned, Laura is the business development director for Autonomy, and I will let Laura introduce Autonomy and just tell us about the work that you're doing and the background to it.
Thank you, Josephine. Hi, everyone. I'm Laura from Autonomy. Autonomy is a service that supports people with learning disabilities primarily, but can be used to support anyone who has difficulty with sequencing tasks to develop skills in the home and for employment that they may otherwise struggle to develop. The way that we support people is through a combination of smart technology and one-to-one human support. So we have an app that our learners will download onto their own smart device that will give them access to all of our content, which is designed to be short, focused videos that relate to a particular skill. So it might be in the employment space, it could be something around what to expect in an interview. In the home space, it might be something like how to cook spaghetti bolognese or something like that. So we have this library of content that learners can access to develop the skills that they require to be more independent in their lives in the areas that are of value to them. So that's kind of the sort of core service that the learners will get from us, and that is supported by a person, a staff member of ours, who will help the learner identify the skills that they want to develop, their own aspirations and motivations for developing their skills. It could be that they want to move into their own accommodation, for example, or that they really want to get a particular job. We will work with them to identify what skills they will need for whatever their aspirations may be, and develop a plan alongside them that can help get them there. So that's sort of the basics of the service that we provide. And how the data comes into it is that after every video, a learner will self-assess how much help they needed with that or how well they understood that video. So then we can collect on our dashboard all of their sort of self-assessments. And over time, that gives us a really rich picture of the skills that the learner is practicing, how they're doing with those skills, if they're progressing, if they're not progressing, if they're sort of plateauing, and all of those things, through our kind of our experience over the last few years, we've learned, we've got a lot of insight now into sort of what different things mean for people. So, if someone has not made progress for a certain amount of time, we can better understand how we can best support them to continue to make progress or sort of restart their journey, really. And that's, really the data side of what we're doing is not just impactful for the individual, but I was really interested in the SWOT analysis, and I was really glad that it was highlighted that, we need to really carefully consider who we're collecting this, who's going to benefit from all of this data, who's going to benefit from the analytics here. And I think one of the things that that I've always really valued about Autonomy is that it's built around the learner themselves, and it's interactive with them, and the data is for them, so that we can use that, the information that they provide to us to help improve their own service and their own sort of their learning. So it's this kind of virtuous circle, which is really nice. And then the extension of that is that it can help local authorities make better informed support decisions, care planning, and it can help support providers better understand the needs of the learners that they might be working with, and then sort of as the sector as a whole, it can develop this sort of body of information and analysis that can better inform services for the future.
Yeah, great. I'm wondering about, because the populations that you're focusing on are people that could be considered vulnerable, so people with learning disabilities, for example. And I just wonder if you've encountered any challenges with regards to how you use data for these types of groups, and how you go about, making sure that informed consent, for example, is sought and working around those difficulties.
Yeah, I mean, this is a really challenging and very sensitive area. And I think, me personally and us as an organization, we're very aware of the responsibility and the, the need to be, to collect the data only for purposes that we can support people with and use it in ways that are beneficial to them. So we are, we're constantly, challenging ourselves to be better in this area. And, like as a minimum, we would always expect, a learner for us to, we would talk to the learner about their data and what we're going to do with it and why it's useful to share it, give them the opportunity to explicitly consent to sharing that data. And we obviously regularly review that. It's not the same for every person either. So some people, they might need more information, less information in different chunks, and all of that stuff is taken into consideration. So there isn't, when you're talking about people, there isn't like, one fixed way that we do that, but we are very much focused on making sure that we act as responsibly as possible, that the learner stays at the center of any decision that's made around their data, and that they're fully informed of who it's being shared with and why. And we would only ever share it with, people that they would approve to share it with, and that would be for reasons that can help them. So that's an ongoing conversation all of the time about how we can make sure that the people we're supporting, the learners that we're working with, actually understand how we're using their data and are benefiting from that.
Yeah, great. I wonder if you could tell me a bit more about the partnerships that you're going. So, for example, do you work with local governments, with providers, with those kind of organizations, and how that come about and works?
Yeah, so we work with any organization that is supporting a learner that we can support, really. That's primarily local authorities. So most of our partnerships are with local authorities, and we'll work with them to kind of identify, if we're a good fit for their aims. I think one of the things that we're really keen on is supporting local authorities or anybody really that wants to work with us to have a clear goal or clear outcome in mind when they're sort of commissioning any kind of technology or data analytics. The value of those things is in what they can facilitate, not solely for, intrinsically, I guess. So we're always very keen to get under the skin of what our partners are trying to achieve and see how we can help them. But primarily we are working with local authorities. We do work with providers and anybody else who's involved in that person's support. So it is like a whole system approach. So we would have, whoever else is working with that learner, we would generally be engaged with as well. So that will be colleges that support learners with needs that we can help with. That's also, there's some supported employment specialists that we would work with for people who are particularly interested in getting into work. Parents and carers, family members, they're always, key to the partnership and the stakeholders that we try to engage.
Great. And what would you say, sort of thinking about where you are now with autonomy, you're still relatively new, I would say. And I just wonder, what are you sort of seeing in the immediate future, what you're hoping to develop through this?
So we've just finished a project with NHS Digital. That was a social care digital innovation accelerator program where we worked with the LGA, NHS Digital, and 6 partner local authorities to develop our sort of first foray into employment support. That was around supporting people to develop pre-employment skills. And off the back of that, one of the things that came out quite strongly from the learners and also the partners on that project was the need for a sort of a follow-on program. So the program, the pre-employment service was very successful. We did, we worked with, I think it was, almost 40 learners to develop skills, and every single one of them made progress on that project. We had some excellent outcomes and really good social return on investment through that program. And right now we're looking to build on that with some grant funding that we've had from UFI to develop a support service for people once they get into the job. So the idea would be that, we're now looking at how we can make even more targeted content and services for people once they get into a job, and we can help them better maintain that by just monitoring how they interact with the service, seeing how they progress, and then we can sort of target interventions that will help them develop the skills where they're struggling, and hopefully provide a better and more efficient way to enable people who have been traditionally excluded from the workplace to access those opportunities.
Thanks, Laura. I'm going to open up the conversation to all of our panelists now, so if you all want to come back on camera. But I will build on what both Victoria and Laura has already been talking about. So in the 2 exemplars that we've heard from Greater Manchester and from Autonomy, we have seen how social care data can be used to good effect into very different contexts. So provision through local government and through, I would call Autonomy social enterprise. I hope that Laura doesn't object to that. And the benefit of data innovation driven by local authorities, for example, is that it addresses problems that are identified as priorities for specific areas and by people who are familiar with the area and with the data sets within it. The drawbacks might be that it relies on the expertise and data readiness within particular organizations, while organizations like Autonomy, on the other hand, have the benefit of being driven by individuals who are often specializing in data and technology and can often be more innovative and agile, but they might struggle to achieve buy-in by social care providers, for example, not least for financial reasons. So I just wonder what you think about the opportunities for collaboration between these different sectors. And I will take that to Arnie first, because I know that you've also got some experience in this space.
Excellent, thanks so much. Yeah, it is a huge opportunity here from the tools. Has already been covered, a sector that's quite often sort of seen as the Cinderella service to health is a phrase that gets used, and also sort of lots of disparate providers that are in different levels of sort of private, public, states, as well as capacity, size, technical development that already exists and all that. Our project is to scope out on that practical side, how do providers get involved in this, how do they sort of use it appropriately, and how do they see the benefits of that. Now, bearing in mind sort of restrictions stopping the amount that I've been able to go out and see this happen in action in providers, what the really important first conversations, both from providers on the ground, going up to local authority, and sort of data teams and the people that aren't related to the sector at all, but working on the tools and everything like that, is that these conversations move really, really positively. And the idea that one process that everyone understands properly and has sort of a fair amount of support to take part in suddenly makes it a lot easier to have these conversations. Now, sharing data between those organizations is obviously a hugely tricky subject, and how you would make everyone happy with that and cover governance and things like that. It could be probably a conversation in this topic for as long as it carries on, but the sort of impetus and the opportunity that's there is huge. So if you can get the sort of support for skills and capacity on maybe some of the smaller providers, some of the providers that are not so technically developed so far, then not only does this collaboration suddenly become possible, but it's sort of maybe even a reason to start putting these in place in certain areas, because you can bring a lot of different stakeholders into a similar conversation then. And we're seeing some really positive conversations from our project. As I said, handing data between people is going to take a lot more than a project leader from a small provider in Bristol saying, come on, it's all for a really good cause, believe me. But the conversations there, and the sort of belief in the opportunity is there, I believe.
Thank you, Arnie. I wonder, Ellen, what are your thoughts on this?
Thanks. So I think we've seen some really excellent examples of collaboration between the sectors. So speaking from kind of the perspective of strengthening how data analytics are used, some of our projects are working with academia, some of our projects are working with analytical consultancies, and I think that the way in which it works really well is if you can work with a partner that is willing to help you kind of, with a common purpose, to help you develop skills, establish that capability, and then build up an approach to that sort of, analytical, to build an analytical approach that really leaves a sustainable legacy. So I think that these collaborations have to be built on trust, but they also have to be underpinned by this commitment to develop capability and skills. And I think, we should be learning from others. And I think that's why the community of practice is a really important place for people to share their experiences and best practice.
Thanks, Ellen. Next question that I wanted to put to the panel as a whole. As we know, the future of health and social care is focused on ever greater integration through integrated care systems. And there have been some concerns about the status of social care within such system. And one criticism of the data strategy, like mentioned earlier, has been that it treats social care as separate rather than integrating it throughout the whole of the strategy. That might be addressed in light of the consultation that is now going through. But if we focus on the positive, how do you see the opportunities for social care analytics in the context of integrated care systems? And I think maybe I will ask Victoria first, considering your experiences from Manchester.
Yeah, I mean, it means that you can look at things at a regional level. And we had to get information governance sign off to get the data that we had from adult social care for the whole of GM. But with ICS as being set up now, I do believe, I might be wrong, but there's certain IG agreements within that make data sharing a lot more easy and have a legal basis for sharing data more easily. And it's such a crucial thing, but it becomes a big hang up on projects where you're trying to do analysis. So I think when you have an ICS as well, it's having that ability to facilitate across a patch and coordinate and work together that we really try to do. And maybe that could work elsewhere as well, rather than having, you've got 10 local authorities in the area who might occasionally talk to each other, but that's worked well. We've established that network of people, of analysts, and I think it could work in other areas if it isn't already. Yeah.
Great, thanks, Victoria. And I see Arnie, you're nodding along there. Did you want to add something to that?
No, I think it's really interesting hearing about governance there and the sort of trust in between different organisations. I think it's really important. I think it's a little bit interesting that sort of in lieu of any sort of promised massive reform to social care services, but now there's an opportunity for us to have data used by other larger institutions, and suddenly there's a lot of support for tech and data side of our services and that development, which you could look at cynically in some ways, but also to have conversations where such huge organizations in health and even sort of the CCGs and things like that are properly saying, well, oh, social care is not even at this table, or social care doesn't have that capacity. Again, a pandemic and suddenly a huge opportunity to use data on a much bigger scale might be a reason why that's happening, but those are really positive conversations. And as I said, even in our very sort of practical community-facing projects, that's anecdotally what we're hearing as well, as people do see that opportunity and they're excited about it.
Thanks, Arnie. I'm going to move on to some of the audience questions. And I first have a question for Laura, which is, how many local authorities are you working with?
So off the top of my head, I think it's we're working with around sort of 15 partners across the UK.
Okay, thank you. And how long was the development stage for autonomy, or for the platform, for the learning platform?
Well, that's a difficult question to answer, because we're kind of sort of continuously developing and implementing recommendations and improvements that come mainly from our learners. But the original service was mainly just the app, and it's just kind of grown organically from that, what we need, what we think would be useful and provide us more insight and more ability to support further development. So it was kind of like the first stage was, here, we can provide you with this tool and this content that's going to help you. And that was sort of, 2013, I think, 12, 13. The service sort of really developed from there into being able to analyze how people are using the tool, implementing some more sort of human support so that they can guide learners through the service to get the most out of what's available for them, and then really learning what the analysis was telling us, what the learners' usage, how often they needed to practice a skill in order to make progress, how long it takes someone to go from not being able to do that skill at all to being able to do it with just watching the video or not even a video at all. So really like a continuous development process. We're learning new things through the data every year, and as the data set grows, it just gives us more and more insight. So I don't think, I think our tech development guy would say, we did this major development and that took a year, but certainly by the time you get your V2 out, you've already written in your head V3, 4, and 5, because there's constantly things that you're learning and things that you want to improve. So the development from, for example, supporting people with skills in the home to supporting people to move closer to employment and then into employment, all of those are things that we, were reflected back to us that this would be helpful for learners. And then so we've kind of further developed the service from that. I don't think we'll ever really feel like it's finished, but that's kind of what's exciting about it.
Great, thank you. I have a couple of questions for Victoria. I have had a couple that are along the same lines, which is whether the data and the graphs and everything that you have, if that is available to the public, and if so, how that can be accessed.
It's not available to sort of the general public. Just it's the Tableau Server is any of the dashboards, the ones that I've done, all the NHS sort of health-related dashboards are available to anyone who works in Greater Manchester local authorities or NHS organisations only. And so it's sort of limited to that set of users. Some of the data is that is in the dashboards is available nationally, though, like CQC data with quality ratings and things like that. But our actual dashboards aren't published or anywhere. They can be the national ones on something called Tableau Public, but we haven't done that as of yet.
Okay, and another question which is kind of related, I think. So from Paul Clarkson. I'm working in Manchester, but I'm at the university. I'm aware that despite the devolution agenda in Greater Manchester, if you're an external analyst or investigator, then data is still very much siloed, i.e. data within the local authorities and data within the NHS. Linkage is often not possible and requires specific governance requirements. I wondered if you could comment on the difference there between yourself as NHS and social care analysts, which sounds great, and other external analysts for whom the data isn't integrated.
Yeah, I can sympathise if you want to do lots of great work with, and you know there's this data set out there, but it's only limited to basically local authorities and NHS. Then it's a drawback of the information governance. It does sound like some of that may change in the future. The adult social care client level data set, the national data set that's coming in, perhaps there may be some, I think you can get what they call a DARS agreement to possibly access that. I don't know if that's the case for academia. I would suppose it would be, but I'm unsure of that. At the partnership, we really do like working with at the university. I think we have been a little bit in the past. The head of BI, Graham Beals, at the partnership has definitely been communicating in the past on things. So you want that partnership working, don't you? It just, yeah, data access is it's kind of a boring issue, but it's so crucial, isn't it? Yeah. I'm not sure if that answers the question, but
thank you, Victoria. I have one final question for you, and it is: what have been the implications or benefits of this approach for social care services delivery in Greater Manchester?
I think I read that one and I was like, oh, that's so hard to answer, because what we're doing is at a strategic level. I think if you work as an analyst possibly in a local authority, you're going to be working more at an operational level, so highlighting maybe when a service user needs X, Y, and Z based on your system. Well, I'm not quite working like that. I'm working across the entire patch, but the data is used by senior managers within local authorities. What quite they use it for and in what reports, it's once it's on the Tableau server, you don't know what it actually gets used in. I do know that because you get user statistics. So there's 500 views on each dash. It's getting used. Quite in what way? We're putting the information out there, so you can say like your market share between different service types, and we've got it benchmarkable across GM, and there's so much out there. But knowing exactly what happens it's really difficult when you work in business intelligence to kind of know exactly where it reaches, so to speak. It's like doing research, so you don't know exactly what happens to it. You produce it, but
yeah, I think the take home is that it's all different parts of the puzzle, isn't it? And it's sort of bringing all of those different parts together and trying to see something whole out of it, rather than trying to answer one big overarching question from only one perspective. It's all about collaborating and working together to pieces together. And it might be a slow process because we are slightly behind, and because of the setup of social care in the UK, which makes it cumbersome to work with sometimes. But that's not important. What is important is that the work keeps going with little pieces here and there. I don't think that we have time for any more questions, so I just want to thank all the panelists today for contributing your time and sharing the interesting work that you're doing. I want to say to everyone who is watching, that if you have any other examples of good examples of effective social care analytics, then please do get in touch, because we're very interested in sharing more exemplars, and we will do that through the website and through the community as we go on. But I we'll stop there and just say thank you everyone for joining us this afternoon. It's been great having you, and I look forward to seeing you at an event soon again.